Hello, I'm Dr. Martin Schnell. I'm going to be talking about hyperbaric oxygen therapy and its role in wound care. The way hyperbarics works is by delivering oxygen under pressure. Hyperbaric oxygen delivers 100% oxygen under pressure, which effectively gives you the equivalent of 250% or 2.5 times more oxygen than is delivered without the pressure. That forces oxygen into tissues, and it works well in the wounds that aren't healing because they lack oxygen, such as arterial wounds, where there's impaired arterial supply. Necrotizing wounds are wounds that have bacteria that can't live in a high oxygen environment. So it works well with those. Works similarly with infections in bone, because bone has such a poor blood supply that it's difficult to get oxygen and nutrients to the infection. And then finally, the one that's most dramatic is soft tissue radionecrosis, or people who have injury to the skin and subsequent wounds after receiving radiation therapy, which is quite common, particularly with skin cancers now, which are treated regularly with radiation. And in soft tissue radionecrosis, the blood vessels are extremely sensitive to the effects of radiation and are destroyed, particularly the ones in the skin and the subcutaneous tissue below the skin. And hyperbaric therapy remarkably creates a new blood supply. It causes a process called angiogenesis, which actually causes the formation of new capillaries and new vessels in that area of tissue that's been destroyed by radiation. Very, very effective in healing these type of wounds, which otherwise often end up with a chronic non-healing wound.